Good day, everyone. We're back.
That's right, we're back, and tonight's episode is going to be extra special. At bakit kaya extra special, Jearu?
This episode is special because we are going to talk about health.
That's right. Today we're going to be talking about all the health issues that are arising amidst the COVID pandemic, and we will also be giving you guys preventive measures and safety measures on how not to be infected by the dreaded virus.
Tama mga partners. We're also having a guest doctor today to talk about men's health. Excited na ba kayong dalawa?
We're very excited, of course.
That's interesting, Avon. And before anything else, ako nga pala ang inyong poging host. I am Jearu.
And I am the only lady host, the only princess of Brandsasia channel, Avon Morales.
And I'm Raymundo from Brandsasia, Race to the New Norm, and welcome to tonight's episode, Health Talk.
COVID-19 is a highly infectious disease caused by SARS-CoV-2 virus. Individuals who are infected might experience common symptoms like dry cough, fever, and tiredness. They can also experience aches, pains, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, and a rash on skin. The surge of cases started last year in March 2020, and as a response, the government had put several parts of the country under community quarantine. A year after the first lockdown, Philippines is experiencing the harsh effects of the pandemic once again. Millions of Filipinos are affected. Thousands of Filipinos are infected every day. And one of them could be you and your loved ones. What can we do to minimize our contact with other people and prevent getting infected?
The COVID-19 pandemic has changed the lives of millions of Filipinos. A lot of our kababayans have lost their lives, and a lot of us have also lost our jobs.
That's true. Walang hindi apektado sa pandemyang ito. Even I, nawalan din ng hanap buhay.
Yeah, since the start of the pandemic, nandun yung worry every day. What if I get infected? What will happen to my loved ones? Andun yung takot. Especially me as a mom, I have kids. And as a career woman, whenever I go out, there is this fear inside me, oh my gosh, what if may makasalamuha akong infected and such?
I can actually feel that, Avon. I know that both of you are aware na I was under observation last time that hindi masyadong maganda yung pakiramdam ko, but thankfully, it was nothing naman. I was negative and I have fully recovered now. Pero alam niyo yun, when you're there at that moment, yung unsure ka pa kung positive ka or negative, you overthink. And I think that's what's scarier about this pandemic, yung overthinking and yung hindi ka sure.
That's right, guys. Nowadays, the world is really filled with so much uncertainties, like the biggest problem that I've noticed is people don't easily have access to healthcare. But that's number one. And as we all know, a lot of us can't get back to our jobs. A lot of kids can't even study. So it's really difficult nowadays, especially for the marginalized members of society. So nakakaawa talaga. So we're really hoping that things get better eventually.
Yeah, I remembered one time last year, there was a father who committed suicide because he thought he had COVID-19. And that time, there was scarcity of test kits pa in the Philippines. And only those in the higher class of the society ang kayang maka-afford nun. So the father, who obviously could neither afford being tested nor admitted to the hospital, chose to die instead para lang hindi niya ma-infect yung family niya.
So sad.
Yeah.
As we all know, dito sa Pinas, even before the pandemic, life is already difficult. So what more nowadays, diba?
Yes, pero that's the thing about COVID-19 kasi. It is something we cannot see or control. That is why what we can only do is, of course, prevent na lang natin.
Yes, and since we're on that page now, let me ask our audience today, what preventive measures have your respective families done since the start of pandemic? Comment it down below with the hashtag Brandsasia Health Talk. Don't forget to share our live stream too.
And 5 Audience will be chosen and given 2 Brandsasia face masks. Kaya comment down na ang ating mga Brandsters and share our live to your friends.
Which is super timing for our topic for tonight because we are talking about prevention. And as we all know, prevention is better than cure. So it's better not to get sick at all. So listen closely as we really tackle on how to keep ourselves safe from being infected by the COVID-19 virus.
Yes, kaya naman iahandog namin ang acronym na
Asawa ko! To prevent COVID-19 infection, always remember the acronym Asawa ko! Oh my God, dear
Asawa ko.
televiewers, wala po akong asawa. We just want to catch your attention to this captivating acronym.
Wait, who made that up? Sinong nag-make up ng asawa ko? It really exists? O ginawa mo lang, Avon?
Ha? Ginawa ko na. Kasi baka sabihin ng televiewers may
Okay.
asawa ko.
basta sure ako hindi sa akin ang galing yan.
Let me hear what asawa ko means. Yeah, I want to know ano ibig sabihin ng asawa ko. I'm just wondering kung talang lumabas ba yan sa TV or ginawa mo lang. But since
The
ikaw yung
actual
gumawa,
name.
explain sa aming lahat and all the Brandsters watching, anong ibig sabihin ng asawa ko?
Then, nag-isip lang ako ng something that will captivate or catch your attention. Sige, asawa ko, pero again, wala akong asawa, mga televiewers, okay? Asawa ko, A stands for avoid crowds and poorly ventilated indoor spaces. S, stay at home whether you're well or unwell and sanitize your living spaces all the time. A, avoid touching your eyes, nose, and mouth. W, wash your hands regularly and wear a mask when physically distancing is not possible. A, ask medical attention if experiencing symptoms like fever, cough, and difficulty breathing. K, keep a safe distance at all times, especially from anyone who is coughing or sneezing. O, only believe news and reports from legitimate sources of health information and news like DOH and World Health Organization.
Very good, Avon. You know what? Ngayon Avon, Jearu, and of course, Doc, huwag niyong kalimutan yung asawa ko.
Ayan, asawa ko.
At wala
Grabe talaga si
Grabe
si Miss Avon, no?
Asawa ko from now on.
Maganda na, witty pa.
Yeah. That's our host natin yan for the A-listers.
Yes, of course. Similar to how others call their asawas when they need help. We can also guarantee that these acronym asawa ko will help us to always remember the guides to prevent us from getting infected.
Kaya alam niyo na, Brandsters, always remember the acronym asawa
Asawa ko.
ko. Hindi asawa mo, asawa ko. Please do follow them and let us help each other prevent the spread of the virus.
Yeah, once again, on a serious note, napaka-witty and it's easy to remember. So maraming salamat for that idea. It's gonna let us remember. And that is actually the least that we could do for our frontliners. Yun yung talagang contribution natin.
Yeah, truly.
Change for the
Yes.
heroism that they're doing for all of us. Diba?
Yes, as we are talking about health, I would also love to express my gratitude to our real fighters, our frontliners.
Yes, as time passes by, sobrang naging underrated na nila. I can actually see posts na some of them are not paid for months and most are working not for money but out of the passion of work na.
That's why, Brandsters, everybody watching, I'd like to remind you all about the significance and importance of our frontliners. They're really heroes talaga.
Yeah, and there are also those who discriminate or undermine our health professionals. If there are medical professionals watching this and the world does not recognize you, we want to tell you, you matter and we appreciate you.
Kaya thank you mga boss. Kayo talaga ang hero sa pandemyang ito.
You know what? Because they're such heroes, I actually made a checklist of all the known frontliners. I might miss a few, but I want to take this opportunity to thank our passionate doctors, our hardworking nurses, our sobrang masipag na mga pharmacists, our matatapang na medical technologists, our radiologic technologists, also yung mababait na physical therapist and occupational therapist. Ex-girlfriend ko, occupational therapist. So kudos to you. And also, yung mga, everybody, all the social workers, all the health professionals. I might forget someone, but you know who you are. Mabuhay kayong lahat, mga heroes.
Thank
Gusto
you
ko
po
lang
sa inyong
i-add,
lahat.
super
Yes.
thank you rin sa ating mga flight attendants. Yes.
Oh, yes. Oo. Ikaw, di ba dati kang flight attendant?
Wag na nating pag-usapan.
Alright. But maraming salamat sa inyo, sa inyong lahat. And now that we're on the talks of health professionals, we actually have a guest today, and he is a urologist.
Yes, he is a very established person in the field. Did you know that he's the chairman of the Department of Urology in FUMC? He's the section chairman of the Stone Center in FUMC, chairman and section head urology in Empire Regenerative Center, senior head of the urology department at Army General Hospital, senior head of the urology department of Navy Hospital, and a senior consultant in the Urology Center of the Philippines. Let us welcome Dr. Joseph Lee.
Yes.
Good evening, Dr. Joseph.
Good evening.
Welcome
Great
to our
day.
show.
Good evening. Great day. Great evening to the three of you, Lance, Avon, and Jearu. Thank you for inviting me in your health talk.
Welcome, Doc Joseph. And batiin niyo naman po ang audience na at ang ating Brandsters.
Of course, Jearu, I like to invite of course, your millions of followers dito sa Brandsasia Health Talk who follow and listen and watch the three of you.
All right, we're very thankful because we have an expert in the field who will help us tonight. As we know, a lot of us are clueless and we're like really lost in the situation nowadays. And iba-iba yung specialization ng mga doctors, of course. But in your specialization, what were the effects of COVID-19 to your patients?
Okay, Lance. Initially, when we were starting the COVID-19 pandemic last year of March, you know that symptoms started to infect the respiratory area, which is the lungs. Okay, in the middle of the year of 2020, the COVID-19 virus starts creeping in the cardiovascular system, the lymphatics, and even the foot area. You even have a COVID foot, right? Okay. Then there was an aspect of the latter quarter of the year that they were studying patients who have been post COVID-19 infected and has been treated and has been labeled cured and managed. They went into looking into men because, as you know, COVID-19 virus specifically, I don't want to say terrorize, but majority of the patients that are affected are the male, right? Then they took samples of the sperm from 100 randomized men who had been COVID infected and cured. They noted that the sperms tend to be morphologically distorted. When you say, Lance, Avon, Jearu, morphologically distorted, meaning there is aberration. Yes, Lance.
Will that affect, the next generation? Of course, if the sperm is morphed, then maybe the children that they'll produce might be affected. Is that a danger for the future?
Yes, I think, especially if you think of the possibility that low sperm count, sperm death, oxygenation stress or oxidative stress, as they most of the time that the COVID-19 does, okay, would cause damage to the sperm formation, sperm morphology, and the sperm count. I think it could tremendously have an effect in the next 5 years to 10 years with regards to the male population.
Oh. So actually, Doc, I read it somewhere. So it's true pala no, that COVID-19 affects fertility in men.
Now, these are all under studies now, Avon.
Right.
No? They are doing research extensively. But whatever we saw last year, the last quarter of the year, should be significantly followed up, Avon, because we do not know, since this year we have already variants. If COVID-19, the original genome of the virus, has attacked the sperm cells already, what could prevail if the variants would attack the young population? We know for the fact, right, Lance, Jearu, it's already taking its toll, especially the variants, on the young population of men. So you will see the effect probably in the next 5 years if you start collecting data on young individuals, especially the fertile men.
One more
Doc,
question, Doc. In conjunction with all the
Chair.
the vaccines that they're making, is the World Health Organization also already as early as now trying to develop a medicine for this particular effect that it has on men?
Now, because all our vaccination vaccines lands covers the general symptomatology of your COVID-19, especially the variants. Even the variants now, they're looking into the subspec of the vaccines if they can really cure, or they will need to have booster elevated in the next few years. When they say booster, you get your first dose and you get your second dose, and you have booster shots every year or every 5 years, okay? Because everything is novel, everything is new, so everything has to go on a very quick clinical trials and studies with regards to what you're saying. If the vaccines can truly protect, especially the male fertility aspect.
I think Jearu has a question. I saw him raising his hand earlier.
Doc Joseph, sorry.
Yes.
Kasi super alarming nung news na ganon. So parang if ever ba gumaling na yung taong infected, will the fertility issue be addressed?
Okay, that's a very good question, right? I'm saying in the sense that we need to further look into this. Okay, we do not want to have residue, Avon. No? When you talk about residue, people who have been cured of the original virus or the variant itself could later on be a residual effect with regards to the male fertility. When you say residual, it will take its toll, Jearu, with regards to the production. In the production of your sperm or your spermatogenesis, so, which is difficult and will take its toll with regards to your fertility in the future. Okay, so we really need to look into this further, not only because of its effect to the respiratory, to the cardiovascular, and to the other organs. I think the kidneys are also affected with it, no? But we need to look into this because the generation or our population will need to be recorded fairly.
I'm hearing a lot of new information. So now definitely we really have to be careful. This is a global pandemic. And of course, there's also a change in medical priorities, as we know, because the hospitals are all crowded. So how was your particular specialty, how was it affected by this prioritization in the hospital? Did it change? Does it have any drastic change in your field? And what are the protocols that you practice nowadays? Did it change as well?
Yes, Lance, it did change. We follow the European Association of Urology protocol with regards to COVID since last year. So we categorize our urological conditions into mild, moderate, severe, and high risk. This is with regards to how we manage, how we do our surgical intervention. because during that time, the early times, Avon, Jearu, we were not allowed to do laparoscopic or anything to do with vaporization because, for the Falklands, we had a lot of non-invasive new innovation with regards to urological, surgical intervention. We have lots of lasers, we have lots of robotics, right? So these are not allowed the early part of last year because they have vapors. And for the fact that the virus persists on air and vapor. So everything has to stop. So we have to go back to our conservative. When you say conservative, the old ways of doing your urological and intervention and management. So there is really a change, and we adopted the change with in conjunction with the EAU and the American Urological Association. So we followed that protocol up to now. We still follow that on the account that we still have COVID cases around.
Thank you, Doc.
Thank you, Doc. Pero ito naman, Doc, medyo lalayo lang ako ng konti. I really want to hear your thoughts about the discrimination on other health professionals naman. What can you say about it, or can you share something about it?
Okay, initially, Jearu, I think the first surge of COVID-19, the initial, when you say initial, that's the mother, no, Avon, that's the mother virus. So parang yung iba nandidiri. Of course, if you don't have the virus, you are scared of people who are in contact with the virus, okay? And one is the health front or the medical front liners, okay? So I think you've heard on the news there are discrimination. Some are kicked off from their dorms and all those stuff. But I think through the months and through the days, things have been changing for the fact that they know that we are part of the algorithm that will combat and fight COVID-19 pandemic, right? So without us, how will the health system be abridged, and how will we combat COVID-19? So I think the discrimination now is lesser as compared to the first bout of the infection, okay?
And I hope that continues to be the trend, Sana tuloy-tuloy na tayo doon. So people who are watching, please take note of that. It's very important.
Of course, you have to know that we work together hand in hand, right? We as a medical frontliners are like missionaries telling you that you have to do this. We basically require you to have simple health protocols like what Avon, Lance, and Jearu, you have mentioned. The first time you came out, you were wearing masks. That's number one. Very good. Then face shield, right? Then social distancing. I know Filipinos in culture have difficulty in doing social distancing. Di ba, Avon?
That's true, Doc.
Beso-beso. Wag muna magbeso-beso. Knuckle greetings. You call that knuckle greetings na lang, or fist greeting. Yun muna lang yun. Pero minsan, di mo pa rin matiis eh. Oo, di ba? Minsan,
Parang
di mo
ito
rin
nga, medyo takot na ako sa ganyan eh. Parang
di ba? I know, di ba? The time we met, when we saw each other, Lance, di ba? Parang ilang pa rin eh. Di ba?
This is
Parang,
better nowadays.
yeah, pero...
Or, ganyan na lang.
Ganun na lang.
Diba?
Kaway-kaway na lang. Yeah.
People understand.
Exactly. So these are things that we need to bear in mind, because this will protect us from COVID-19.
Avon, I think she has one more question.
Actually, initially I was supposed to have questions, kaya lang my questions were already captured by your questions. Siguro just like to add lang, no? Yes, I think initially talaga, yung mga wearing mask, may discomfort at first eh. Like when I initiated that in the office, kasi I'm an HR head. So parang may discomfort. sometimes they would wear mask pero nakalabas yung ilong, di ba? So we really have to be strict, no, and we have to impose mga sanctions, no, for them to really follow. It's for them, but the packaging is always, it's for you and for your loved ones. It's for all of us. So that's the packaging. We want them to understand the importance of wearing such. But initially talaga there was discomfort, lalo na, di ba, sanay tayo nagsasalita na walang nakaharap sa face. So yun, but at least now, di ba, people are get used to wearing mask. Yun yung na-observe ko ngayon. And I'm happy naman that yun, we're compliant to mga ganyang mga protocols. It's for our safety anyway. Are there questions, guys?
I have one final question for Doc. No?
All right.
From someone from the urology, side of medicine, any special instructions for us, civilians, on how to be safe from the virus? Because we know we've heard from cardiologists, we've heard also from other doctors, but from urologist point of view, ano yung mga hindi pa namin na-touch na baka kailangan namin malaman?
Okay, first and foremost, Lance, if you have heard the questions that the three of you and the topic that we discuss, and you are on your 40s, or you just got married, and you got COVID, di ba, Avon? I think the possibility of you going into a checkup, that's one. All right? This is on the topic that we discussed.
Okay. Yes.
On the general aspect, we still follow what the other specialty would warrant us, right? So the health protocols, okay? Now for the comorbid patients, like for us in urology, those who are going into dialysis, those who are on kidney transplant,
yes,
those who have other problems with regards to the kidney, I think you have to do extra consultation and care, because we want those aspect of not going into a crisis, okay, or a chronic renal crisis later on. This is entailed with patients who have been afflicted with COVID, okay, with concomitant kidney problems, okay. You've heard of cytokine crisis, right? This is a overwhelming surge of activity of the kidney because of the COVID-19 virus.
And in line with that, no, I know I said it's my last, but any urological symptom that we should watch out? Like some people were paranoid, baka kung nababalisyaw sa baka sa COVID na yun, that you can go to the bathroom. Anything to watch out for? Para lang we know.
Siguro Lance, flank pains and pelvic pains. Kasi COVID, what is the symptom of your COVID? Fever, sore throat. Sore throat, difficulty of breathing, and pain. Diba, Avon? Body pain, malay. Siguro yung malay and body pain, let's center it on additional lower back pain. Parang pati yung lower back pain and pelvic pain ko sumasakit. So we can equate it, Lance, to the possibility your urogenital system might have been affected also.
Right. Thank you so much, Doc. Thank you so much. We learned a lot tonight.
Thank you.
Jearu, do you have questions pa?
Yeah, questions, Jearu?
Well, ako, okay na ako. Marami na akong natutunan na bago na hindi ko naririnig sa news and sa mga ibang nababasa ko. And that's very informative para sa ating lahat.
For the young kasi, Avon and Lance, I just want to know, there is very common now in clinics that you call that quarantine lockdown for men. Because of stress and anxiety, they have transitory erectile dysfunction. I have a lot of patients like that.
Is it a psychological effect or?
That is a temporary thing for young adults, because suddenly they're locked up. They cannot move around. They cannot intermingle with So suddenly the male organ suddenly left them for a certain transient portion. I have a lot of patients that si Avon.
All right, now you guys know.
Totoo. But it's correctable, but this is psychological because we have the organic type also.
Well,
So
that's
that's
what's so
part of
special about
fertility.
Brandsasia channel. We deal with not only the common topics, but topics that
Yeah.
actually we should know, but probably
Yes.
still don't know
Exactly.
about. So
Ngayon
maraming
ko nga lang
salamat
narinig yung
for
part
tonight's
na yun.
episode.
Yeah, thank you so much, Doc.
Thank
Sobra.
you,
Thank you so much,
Lance,
Doc, for
Avon,
giving us a little
Thank
of
you
Jearu.
your
so much, Doc.
time.
Thank
We
you.
really appreciate it. Is there any advice you could give to our audience as a doctor and urologist? Doc?
Okay. In general muna tayo,
Yes.
Avon, no? So,
Sure.
health protocol, you follow that, and social distancing, like the three. And I love the time that you were wearing mask before you unmask. Okay. So, yun muna gawin natin, basically. Now, with regards to my specialty, if you have problems now, as I mentioned a while ago, and we discussed early on, then you have to have yourself check, general checkup. Don't worry, there are things that you can do. There is laboratory. You have us to help you, specialists, in order to overcome whatever circumstances, especially when you talk about your spermatogenesis or your sperm formation and low production of sperm due to COVID-19.
How can
Alright.
our Brandsasia audience get a hold of you, Doc, in case they want to consult or if they have any, concerns that need your counsel as a urologist?
Of course, they can ask for your number so you can flip it to me, or they can visit me in my hospital. Okay, I hope I
Actually,
can give
Doc,
it to
di ba
you.
you have a Facebook page? Probably they can
Yes.
reach you there, di ba?
Yeah,
Oh,
maybe
yes,
you could
face
mention
to
it to
face.
our audience as well.
All right. Okay. You can visit me at my Facebook page, Dr. Joseph Lee. Maraming nagme-message doon na Avon. So I answered them. I answered them
I'm
freely.
actually following your Facebook page.
Oh, thank you. Thank you. Thank you. Thank
That's why I
you.
know.
Thank you.
So once again, thank you so much. I really enjoyed tonight, and I'm sure our audience as well really enjoyed, and they're super educated tonight sa mga bagong kaalaman from our very distinguished guest, Dr.
Yeah,
Lee.
that's right. Thank you for joining us, Doc, and thank you everyone for watching. I hope you all learned a lot from this episode. Again, I am Avon Morales from the A-Listers, reminding you all to stay safe and remember ang asaw ko.
And I'm Lance Raymundo, host of Brand Start Race to the New Norm. And don't forget to wear your face mask when you go out for the essentials, and always stay at home and remember all the protocols.
And this is Jearu Magbuhat reminding you that Brandsasia will be here for you. This is Health Talk. And remember, asawa ko. And please stay tuned sa sa marami pang episodes ng I Am Jearu. And don't forget your face mask.
See you guys again on our next show. Bye-bye. Thank you for joining us
Good night,
tonight.
guys.
Good night.
Good night.
Bye.